What is the primary concern when collecting a capillary sample on a dehydrated elderly patient? A. Increased blood flow may lead to overcollection. B. Hemoconcentration may cause inaccurate results. C. Capillary tubes may not fill fast enough. D. Risk of arterial puncture is higher. Answer: B. Dehydration causes hemoconcentration, making capillary results less accurate due to concentrated blood components. Which additive in a blood collection tube prevents glycolysis? A. Sodium fluoride. B. EDTA. C. Heparin. D. Sodium citrate. Answer: A. Sodium fluoride inhibits glycolysis, preserving glucose levels in blood samples. During a routine venipuncture, what should the phlebotomist do if blood flow stops after partially filling the tube? A. Remove and reinsert the needle. B. Pull back the needle slightly. C. Push the needle further into the vein. D. Start the procedure from the other arm. Answer: B. Slightly adjusting the needle position can restore blood flow if it's against the vessel wall. Which of the following requires the strictest chain of custody? A. Lipid panel. B. Blood culture. C. Drug screen. D. Hematocrit. Answer: C. Drug screening tests require chain of custody to maintain legal integrity of the sample. What is the correct angle of insertion for a venipuncture in the antecubital area? A. 10 to 15 degrees. B. 30 to 45 degrees. C. 15 to 30 degrees. D. 45 to 60 degrees. Answer: C. The standard angle for venipuncture is 15 to 30 degrees to enter the vein safely. Which of the following tests must be protected from light? A. Prothrombin time. B. Bilirubin. C. Ammonia. D. Glucose. Answer: B. Bilirubin is light-sensitive and must be protected to prevent breakdown of the analyte. A patient begins to feel faint during venipuncture. What should the phlebotomist do first? A. Complete the draw quickly. B. Remove the needle and lower the head. C. Give the patient water. D. Ask the patient to lie back. Answer: B. Safety comes first, the needle must be removed immediately, and the patient assisted safely. Which of the following sites should be avoided for venipuncture in a diabetic patient? A. Median cubital vein. B. Back of the hand. C. Foot veins. D. Basilic vein. Answer: C. Foot veins are generally avoided in diabetic patients due to poor circulation and healing. What is the primary purpose of the tourniquet during phlebotomy? A. Prevent backflow. B. Make veins more visible and palpable. C. Sterilize the site. D. Increase patient comfort. Answer: B. A tourniquet temporarily restricts blood flow, making veins more prominent for easier access. When collecting blood cultures, what is the first step after identifying the patient? A. Label the bottles. B. Clean the site with alcohol. C. Perform hand hygiene and put on gloves. D. Insert the needle. Answer: C. Proper hand hygiene and PPE use are required before handling sterile equipment or the patient. Which of the following tubes should be used first when performing a venipuncture on a patient requiring blood cultures and coagulation tests? A. Red. B. Light blue. C. Yellow, SPS. D. Green. Answer: C. Blood culture tubes, yellow/SPS, must be drawn first to prevent contamination from additives in other tubes. A lavender top tube is primarily used for which of the following tests? A. Blood culture. B. Coagulation studies. C. Complete blood count, CBC. D. Serum electrolytes. Answer: C. Lavender tubes contain EDTA and are used for hematology tests such as CBC. Which of the following best describes the correct order of draw for the following tubes: green, light blue, lavender, and red? A. Red, lavender, light blue, green. B. Light blue, red, green, lavender. C. Red, green, lavender, light blue. D. Light blue, lavender, red, green. Answer, B. According to CLSI, the correct order is light blue, red, green, lavender. Why must a tourniquet be removed within 1 minute during venipuncture? A. It increases blood pressure too quickly. B. It prevents excessive vasodilation. C. It reduces hemoconcentration risk. D. It allows the vein to collapse. Answer, C. Prolonged tourniquet application can cause hemoconcentration, leading to inaccurate lab results. Hemolysis in a blood sample can be caused by A. Using a small bore needle. B. Allowing alcohol to dry before puncture. C. Using the correct order of draw. D. Gently inverting the tube. Answer, A. A needle that's too small can rupture red blood cells, causing hemolysis. Which of the following actions should be taken if a hematoma starts forming during venipuncture? A. Continue drawing until the tube is full. B. Withdraw the needle immediately. C. Tighten the tourniquet. D. Switch to another arm immediately. Answer, B. If a hematoma forms, stop the draw immediately to prevent tissue damage. Which additive prevents blood from clotting by binding calcium? A. Heparin. B. EDTA. C. SBS. D. Thrombin. Answer, B. EDTA binds calcium and prevents coagulation, making it ideal for hematology tests. What is the appropriate action if a patient feels faint during a blood draw? A. Speed up the draw. B. Continue unless they lose consciousness. C. Stop the procedure and ensure safety. D. Ask them to lie down and wait. Answer, C. Patient safety is the priority. Stop the draw and provide care immediately. Which of the following is a correct site for heel puncture in an infant? A. Medial arch. B. Posterior heel. C. Center of the heel pad. D. Lateral or medial plantar surface. Answer, D. The proper site is the lateral or medial plantar surface to avoid bone injury. What action should be taken if blood does not flow after the needle is inserted? A. Remove the needle and try again. B. Adjust needle position slightly. C. Apply pressure to the site. D. Change the patient's position. Answer, B. Slight adjustments can correct improper needle placement without restarting. Which color-coded tube contains sodium citrate as an additive? A. Green. B. Light blue. C. Red. D. Gray. Answer, B. Light blue tubes contain sodium citrate, commonly used for coagulation tests. For which type of specimen is a gray top tube most appropriate? A. Glucose and blood alcohol. B. Blood culture. C. Platelet count. D. Serum electrolytes. Answer, A. Gray top tubes contain additives that preserve glucose and alcohol levels. Which of the following is the most important step before drawing blood? A. Applying the tourniquet. B. Identifying the patient. C. Choosing the tube. D. Disinfecting the skin. Answer, B. Patient identification is critical to prevent medical errors and ensure accuracy. In capillary collection, which test must be collected first? A. Bilirubin. B. Electrolytes. C. CBC. D. Blood gases. Answer, D. Blood gases must be collected first because they are most sensitive to air exposure and timing. Which of the following conditions requires strict adherence to contact precautions during blood collection? A. Tuberculosis. B. Hepatitis A. C. MRSA. D. Influenza. Answer, C. MRSA is spread through direct contact, requiring contact precautions to prevent transmission.